I will talk about session 11 to 14, and this would include the steps 5 to step 10 of the 10 steps of a successful breastfeeding practices. Session 8 would include steps 6, 7, 8, and 9. These are practices that assist breastfeeding. On the completion of session 8, the participant will be able to describe their role in the practices that assist rooming in, describe their role in practices that assist baby-led or demand feeding, suggest ways to wake a sleepy baby and to settle a crying baby, list the risks of unnecessary supplements, describe why it is important to avoid the use of bottles and teats, and lastly, discuss removing barriers to early breastfeeding. Step 6. Give newborn infants no food or drink other than breast milk unless medically indicated. Healthy preterm babies rarely have a medical need for supplements or pre-lactal feeds. They do not require water to prevent dehydration. So here's a case study. Miriam gave her previous baby regular supplements from birth. Now she is hearing that supplements are not good for babies and wants to know why. What can you say to Miriam as to why supplements are not recommended? Exclusive breastfeeding is recommended for the first 6 months of life. Dangers of supplements would include the following. It overfill a baby's stomach so the baby does not suckle at the breast. It reduces the milk supply because the baby is not sucking, resulting in overfullness of the breasts. It causes the baby to gain insufficient weight if feeds of water, teas, or glucose water are given instead of milk feeds. Also reduce the protective effect of breastfeeding, thus increasing the risk of diarrhea and other illnesses. Also expose the baby to possible allergens and intolerances that could lead later to eczema and asthma. It reduces the mother's confidence if a supplement is used as a means of settling a crying baby. Also becomes an unnecessary and potentially damaging expense. In addition to the points listed, there are more reasons why supplement is not recommended. A mother who is looking for a supplement may be indicating that she is having difficulties feeding and caring for the baby. It is better to help the mother to overcome the difficulties than give a supplement and ignore the difficulty. A health worker who offers a supplement as the solution to difficulties may be indicating a lack of knowledge and skill in supporting breastfeeding. Frequent use of supplements may indicate an overall stressful atmosphere where a quick temporary solution is chosen in preference to solving the problem. Prelactal feeding or offering formula to an infant of an HIV-positive woman who will breastfeed may alter the gastric mucosa and allow the transmission of virus. When we cannot test the HIV status of mother, it is important to emphasize that exclusive breastfeeding reduces the risk of HIV transmission during breastfeeding. If a mother has been counseled, tested, and found to be HIV positive and has decided not to breastfeed, this is an acceptable medical reason for giving her milk formula or a replacement food. Even if many mothers are giving replacement feeds, this does not prevent a hospital from being designated as baby-friendly if those mothers have all been counseled, tested, and made genuine informed choices. Step 7. Practice rooming in. This would allow mothers and infants to remain together 24 hours a day. Routine separation should be avoided. After Delivery of mother. Mothers with normal babies, including those born by cesarean section, should stay in the same room day and night, except for periods of up to an hour for hospital procedures, from the time they come to their room after delivery or from when they were able to respond to their babies in the case of cesareans. It should start no later than 1 hour after normal vaginal deliveries. Normal postpartum mothers should have their babies with them by their bedside unless separation is indicated. Separation should only occur for an individual who needs clinical help. What can you say to explain the importance of rooming in to mother? The following are the benefits of rooming in. The babies sleep better and cry less. There is continuation of sleep-awake rhythm that develop even before birth. Breastfeeding is well established and continues longer. The baby gains weight quickly. It facilitates demand feeding. Rooming in, wherein feeding on cues is easier, develops good milk supply and early breast milk production. The mothers become confident in caring for their baby. Mother can see that their baby is feeding well. Baby is exposed to fewer infections, and it promotes bonding even if the mother is not breastfeeding. What barriers are sometimes seen to rooming in as routine practice? Barriers to rooming in and possible solutions are the following. First, concerns that mothers are tired. Ward routines should facilitate mothers' rest during quiet times, and there should be no cleaning, no visitors allowed, no medical rounds or procedures to be done. You should review birth practices to determine if long labors, inappropriate use of anesthesia and episiotomies, lack of nourishment, and stressful conditions resulted in mothers being extra tired and uncomfortable. Another barrier to rooming in is taking the baby to the nursery for procedures. Baby care should take place at the mother's bedside or with the mother present because this can provide assurances and opportunities for the mother to provide comfort if the baby is in distress. Third, the belief that newborn babies need to be observed. A baby can be observed next to the mother as easily as in a nursery. A mother is very good at observing her own baby and often notices change before a busy nurse notices them. Close observation is not possible if the baby is in the nursery with many babies. Another barrier to rooming in is that there is no space in the ward for the baby cots. Babies can share their mother's bed. The bed sharing or co-sleeping can help a mother and baby get more rest and to breastfeed frequently. The bed may need a side rail, chair against the bed, or the bed against the wall. That is to reduce the risk of the baby falling out of bed. Staff do not know how to assist mothers in learning to care for their babies. Soothing and caring for a baby is an important part of mothering. Helping a mother to learn to care for her baby at night is more useful to the mother than taking her baby away to a nursery. Taking the baby away may reduce mother's confidence that she can cope with being a mother. Mothers ask for their babies to be taken to the nursery. So you have to explain to the mother why the hospital encourages rooming in as a time to get to know her baby and as beneficial to her baby and herself. Discuss the reason why the mother wants her baby taken to the nursery and see if the difficulty could resolve without taking the baby away. You have to address the benefits of rooming in during antenatal contacts. If separation of a mother and an infant is required because of a medical situation, document the reason for this separation in the mother or baby record. The need for separation should be reviewed frequently so that it is as short a time as possible. During separation, encourage the mother to see and hold her baby if possible, and ask the mother to express her breast milk. Roaming in has benefits for the mother, baby, and hospital, in addition to those listed earlier. Babies are more responded to more quickly with less crying, thus using less of the baby's energy stores and reducing temptation to give artificial feeds. Frequent feeding means jaundice is less frequent and does not reach such high levels. Higher maternal attachment, less parental abuse, and less abandonment are linked in rooming in. Roaming in also reduces infection rates as fewer staff are in contact with the baby. In addition, the mother's bacteria colonize her infant with her own flora at the same time giving immune protection through her milk. Reduce infection rates, reduce use of artificial feeds, and reduce need for nursery space all save the hospital money. Confident mothers and well-established breastfeeding as hospital discharge results in less use of post-discharge health services. Mothers who are HIV positive and mothers who are not breastfeeding also benefit from rooming in. Rooming in assists them to get to know their baby and become confident in caring for their baby. Co-sleeping, bed sharing, or bedding in. Bed sharing or co-sleeping can help a mother and baby to get more rest and to breastfeeding frequently. However, co-sleeping is not recommended if either the mother or the father is a smoker, under the influence of alcohol or drugs that cause drowsiness, unusually tired and might not respond to the baby, ill or has a condition which could alter consciousness such as epilepsy and unstable diabetes, the mother is very obese, mother is very ill or the baby is also ill or other child in the bed is very ill. Here are the guidelines for the safe bedding or co-sleeping. Discuss the benefits and contraindications to bed sharing so that parents are informed. Use a firm mattress, not one that is sagging. Sleeping on a sofa or cushions with a baby is not safe. Keep pillows well clear of the baby. Cotton sheets and blankets are considered safer than a soft quilt. Dress the baby appropriately. Do not swaddle in wraps or blankets if baby sharing, or the baby should not be overdressed. The mother's body provides warmth for the baby. The mother should lie close to her baby, facing the baby, with lying on his or her back, except when feeding. Ensure that the baby cannot fall out of bed or sleep between the side of the bed and the wall. Ensure that the mother can easily call for assistance if she has difficulty moving in bed. Check the well-being of the mother and baby frequently, ensuring that the baby's head is uncovered and that the baby is lying on his or her back if not feeding. When endorsing overcare to another staff member, make them aware of those mothers and babies who are bed sharing. What are the disadvantages of not rooming in or taking the baby to the nursery? There is increased risk of infection leading to epidemics of diarrhea and staphylococcal skin disease among neonates. Infants are fed by the staff with formula or water while in the nursery. Nursery care interferes with demand feeding and increases the likelihood of difficulties with breastfeeding. Infants in nurseries cry more. Caregivers in nurseries do not respond as often as mothers who are in the same room. Nurseries increase demands on staff time. restrict interaction between mother and infant, which may hinder bonding. Also, it reduces maternal confidence. Reasons for not roaming in, as mentioned earlier, would include nursery care allows better supervision of the baby. The mother's sleep is disturbed if infants are in the same room. Some mothers request their babies to be taken to the nursery so that they can rest. The layout of the ward makes rooming in difficult and architectural changes would be expensive. No, there's no space in the ward for baby's cot. In private hospitals, rooming in may be difficult to charge a nursery fee. Taking the baby to the nursery for procedures wherein the beliefs that newborn babies need to be observed. During separation, encourage the mother to see and hold her baby if possible and to express her milk. The staff do not know how to assist mothers in learning to care for their babies. Step 8. Encourage breastfeeding on demand. Mothers of normal babies, including cesareans, who are breastfeeding should have no restrictions placed on the frequency or length of their baby's breastfeeds. Mothers should be advised to breastfeed their babies whenever they are hungry or as often as the baby wants, and they should wake their babies for breastfeeding if the baby's sleep is too long or the mother's breasts are overfull. Demand feeding or unrestricted or baby-led feeding or in response to the baby's cues, which means that the frequency and length of feeds is determined by the baby. It is the baby who would dictate when he or she will feed. How can you explain why baby-led feeding is recommended? So the following are the importance of baby-led feeding. First, the baby gets more immune-rich colostrums and therefore more protection from illness. There is a faster development of milk supply if the mother is giving the baby on-demand feeding. There is also faster weight gain, less neonatal jaundice because colostrum acts as a laxative. There is increased duration of breastfeeding. The infants learn to recognize their own signs of hunger and satiety, and this may be related to the lower rates of obesity. There is also less breast engorgement since the mother is able to empty her breast with milk. Mothers also learn to respond to her baby. Breastfeeding is established faster. The baby seems to be less crying, and there's also less temptation to use supplements or artificial pacifier. Also helps bonding and development between the mother and the baby. Demand feeding also helps delay a new pregnancy. It also protects mother's health from getting breast cancer or ovarian cancer, and is it cheaper to breastfeed compared to artificial feeding. Infants who are allowed to control the frequency and duration of a feed learn to recognize their own signs of hunger and satiety, and this ability to self-regulate may be related to the lower rates of obesity in children who were breastfed. What are the signs to watch for in a newborn baby to indicate when to feed the baby? By the time the baby is crying, this means that they are already upset and hungry. Crying usually is a late hunger sign in babies. Before baby cries, they normally signal that they need a feed with several kinds of hunger cues. And here are some of the early hunger signs that the baby might exhibit. So the following are the early hunger signs. First, there would be increase in eye movements under closed eyelids, or the baby would open their eyes. They become more awake and active, just the thinking of they're about to feed. They open their mouth, stretches out the tongue, and turns the head for the breast. They make some sucking motions with their mouth, smacking their lips, or drooling more. They can also make some whimper sounds. This is one of the early hunger signs. Some would have socks or chews on hands, fingers, blanket or sheet, or other object that comes in contact in their mouth. Clenching their hands into little fists because they are getting a little frustrated and impatient. They also give you a furrowed brow, distressed look that says, "When are we going to eat?" The following are the late hunger signs, which we do not want to happen in babies. The baby is crying loudly. They arches their back, has a difficulty in attaching to the breast, and the baby then needs to be held and calmed before the baby is able to feed. Some babies are very calm and wait to be fed or go back to sleep. If not noticed, this can result in underfeeding. Other babies wake quickly and become very annoyed if not fed immediately. So, help the mother to recognize her baby's temperament and learn how to best meet her baby's needs. So, the babies cry for several reasons. So, the following are the causes of crying and suggestions what to do in the babies who are crying. First, this would be caused by boredom or loneliness. So what you can do is carry or talk to the baby. Second, it would signal that the baby is hungry. So the mothers may be reluctant to feed their babies frequently if their expectations are 3 to 4 hourly feeds. Many babies do not follow the same feeding pattern all of the time. So encourage mothers to offer a crying baby the breast. Next would be discomfort as a cause of crying. So respond to the baby's needs. Look for what the baby needs. Look or check for the diaper if it is wet. And then check if it is too cold or too hot in the room. Crying may also cause of illness or pain. So you have to check the baby and treat accordingly. Tiredness is also a cause of crying. So you have to hold or rock the baby in a quiet place to help them to go to sleep. Reduce visitors, handling, and stimulation. Next cause would be something in the mother's diet that would cause babies crying. This is not very common and there are no food that it is possible to recommend for mothers to avoid. Suggest that the mother stop eating the food to see if the crying improves. So she can check further by eating the food again to see if it causes the problem again. Some would be caused by effects of drugs. If the mother takes caffeine or cola drinks, the caffeine can get into the milk and make a baby restless. Cigarette smoke, even someone else is smoking in the household, can also act as a stimulant to the baby. So, the mother can avoid caffeine and cola containing drinks. Ask smokers not to do so in the house or near the baby. Colic. Colic does not have a precise definition and the term may mean different things to different people. Exclude first other causes of crying. A baby with colic grows well and tends to cry at certain times of day, often in the evening, but is content at other times. So you have to check the baby's feeding. Poor attachment can result in air being swallowed, which causes the wind. A very fast milk flow or too much high lactose for milk can cause discomfort. So attention to breastfeeding management may reduce these problems. So what are the ways to settle a crying baby? First, a mother and her family may think that a crying baby means that the mother does not have enough milk or that her milk is not good enough for a baby. A crying baby can be difficult for a mother and reduce her confidence in herself. and her family's confidence in her. A baby who is crying too much may really be crying more than other babies, or the family may be less tolerant of crying or less skilled at comforting the baby. It is not possible to say how much crying is normal. If a baby is crying frequently, so you have to look for the cause. Listen to the mother and learn what her situation may be. Observe her how to breastfeed, examine the baby, and refer for further medical attention if needed. So babies may cry from hunger, pain, loneliness, tiredness, or some other reasons. So you have to build the mother's confidence in her ability to care for her baby and give her support. So listen and accept what the mother is feeling. Reinforce what the mother and baby are doing right or what is important or normal. Give relevant some information. Make one or two suggestions and give practical help. So the following are the suggestions and practical help to ease the crying of babies. First, make the baby comfortable. You have to check for the diaper if it is dry, clean, and check for the room temperature if the baby is comfortable being warm or too cold. Next, put the baby to the breast. The baby may be hungry or thirsty or sometimes just wants to suck because this makes the baby feel secure. So put the baby on the mother's chest, skin-to-skin contact. The warmth, smell, and heartbeat will help soothe the baby. So you can talk, sing, or rock the baby while holding close. Put the baby to the breast. So make a gentle stroke or massage the baby's arm, legs, and back. So give one breast at each feed. Give the other breast at the next feed. If the breast not used at that feed becomes overfull, so the mother should express a small amount of milk. Next, reduce the mother's coffee and other caffeine drinks. Do not smoke around the baby and smoke after feed, not before or during if a mother is a smoker. So have someone else carry and care for the baby for a while. Involve other family members in the discussion so the mother does not feel pressured to give unnecessary supplemental feedings. So family support is very important. Hold the baby in a manner that wraps around and supports head, body, legs, and arms so the baby feels secure. If the baby seems to be sleepy to feed, suggest the following to the mother. Remove the blanket and heavy clothing and let her baby's arms and legs move. So breastfeed with her baby in a more upright position. You can do some gentle massage on the baby's body and talk to her baby. Wait half an hour and then try to breastfeed again. Avoid hurting the baby by flicking or tapping on the cheek or the feet. So this might harm the baby. What indicates that the baby has finished feeding? So these are the signs of satiety that will tell you that the baby is already full. At the start of a feed, most babies have a tense body. As they get full, their body relaxes, open and relax hands instead of clenched fist. Most babies let go of the breast when they have had enough. So they close their mouth and not responding to encouragement to latch on or suck again, though some continue to take small gentle sucks until they are asleep. So explain to the mother that she should let her baby finish one breast before offering the other breast in order to feed the rich hind milk and to increase milk supply. So what are the feeding patterns? Some babies feed for a short time at frequent intervals. Other babies feed for a long time and then wait a few hours until the next feed. Babies may change their feeding pattern from day to day or during one day. So teach the mothers typical feeding pattern for a full-term healthy newborn. Newborns want to breastfeed about every 1 to 3 hours in the first 2 to 7 days, but it may be more frequent. Night feeds are important to ensure adequate stimulation for milk production and milk transfer and for fertility suppression. Once lactation is established, the milk supply comes in. 8 to 12 breastfeeds in 24 hours is common. There are usually some longer intervals between some feeds. During periods of rapid growth or development, a baby may be hungrier than usual. They feed more often for a few days to increase milk production. So let the babies feed whenever they want. This satisfies the baby's needs if hungry or thirsty, and the mother's needs her breasts are full. Very long feeds, which is more than 40 minutes for most feeds, or very short feeds, meaning less than 10 minutes for most feeds, or very frequent, meaning more than 12 feeds in 24 hours or most days, may indicate that the baby is not well attached at the breast. So sore nipples are the result of poor attachment, not the result of feeding too often or too long. If a baby is well attached, it does not matter if she or he feeds often or for a long time at some feeds. In special situations, the mother may need to lead the feeding for a baby or two and wake the baby for feeds if the baby is very sleepy. This is due to prematurity, jaundice, or the effects of labor medication, or if the mother's breasts are overfull and uncomfortable. So it is important in these special babies that you wake them up so that they can start feeding at the right time. Babies who are in replacement fed also need to be fed in response to their needs. Sometimes there's a tendency to push the baby to finish a feed because the milk is prepared. This can lead to overfeeding. A mother can watch her baby for signs of fullness. And these are the signs like turning away and reluctance to feed. A replacement feed should be used within an hour of the baby starting the feed and not kept for later as bacteria will grow in the milk. If baby does not finish the milk in one feed, this can be mixed into older siblings' meal. We go to step 9. Give no artificial teats or pacifiers, also called dummies or suitors, to breastfeeding infants. So why is it recommended to avoid using bottles and teats? The problems in the use of artificial teats. It may affect milk production. There would be less milk production if you use artificial teats because less milk will be emptied from the breast. Second, it may develop a preference for an artificial teat or pacifier. And later, the baby will refuse to suckle on the mother's breast. The baby takes less milk and grows less well. It can also carry infection and are not needed even for the non-breastfeeding infant. Ear infections and oral dental problems are more common in the artificial teats or pacifier use, and it may be related to abnormal oral muscle function. In the rare situation that a supplement is needed, feeding with an open cup is recommended, as a cup is easier to clean and also ensures that the baby is held and looked at while feeding. It takes no longer than bottle feeding. What are the advantages of breastfeeding? The breast milk is a perfect nutrient for an infant because it is easily digested, due to the special enzymes and efficiently used. It also protects the baby against infection due to the immune factors present in breast milk. When the mother gets infected, the white blood cells in the mother's body make antibodies to protect the mother. So some white cells go to the breast and make antibodies there. These antibodies of the mother is secreted in the milk to protect the baby. It also helps bonding and development. It also helps delay a new pregnancy, protects the mother's health, and costs less than artificial feeding. What are the differences between colostrums and mature milk? Your colostrum is antibody rich. It protects against allergy and infection. It also contains many white cells that also protects against infection. As a laxative, it clears the meconium and helps to prevent jaundice. It also contains growth factors that helps intestine to mature and also prevent allergy and intolerance. It is also rich in vitamin A, which reduces severity of infection. It has an advantage in emotional bonding. There is a close, loving relationship between mother and baby in breastfeeding. The mother is more emotionally satisfied. There is less crying among babies who are breastfed, and baby may be more emotionally secure. And in development, the children who are breastfed perform better on intelligence tests. So what are the disadvantages of artificial feeding? First, it may interfere with bonding. Second, more diarrhea and persistent diarrhea would be seen among artificially fed babies. There is more frequent respiratory infections, and some may cause malnutrition due to vitamin A deficiency. There is more allergy and milk intolerance, and the increased risk of some chronic diseases. Artificial feeding may cause obesity, and it lowered the scores on intelligence tests. The mother may become pregnant sooner, and there would be an increased risk of anemia, ovarian cancer, breast cancer among mothers who are not breastfeeding. So in summary, rooming in and baby-led feeding help breastfeeding and bonding. The mothers can notice and respond to their babies with ease when they understand their baby's feeding cues. The baby cry less, so there is less temptation to give artificial teats. Mothers are more confident about caring for their babies and breastfeeding. Breastfeeding is established early. The baby gains weight well, and breastfeeding is more likely to continue for longer. Help mothers to learn skills of mothering. So help the mother to learn how to wake a sleepy baby. Help the mother to learn how to settle a crying baby, and also help to learn how to look for hunger cues. Prelactal and supplemental feeds are dangerous because this would increase the risk of infection, intolerance, and allergy. And this will also interfere with the sucking that would make breastfeeding more difficult to establish. Use of artificial teats, pacifier, or nipple shield may also affect milk production.